Thank you, Dr. Pauline Lai, for your kind introduction and for letting me share my personal experience with stroke. There are different types of stroke, and the severity depends on how widespread the damage area is. I suffer from a rare cerebellar stroke, which occurs in less than 10% of cases. And this stroke is due to the blockage of the blood supply into this lower brain area. It can potentially be fatal if left untreated. The function of this lower brain is, our cerebellum, is to coordinate muscle movement to maintain posture and balance. It can easily be mistaken for vertigo as the symptoms are similar, such as dizziness, vomiting, nausea, headache, and double vision. My neurologist, through MRA or magnetic resonance angiography, confirmed that I suffer a cerebellar stroke. I had just celebrated my 60th birthday in the company of family and friends who have contributed greatly to the happiness and fulfillment in my life. However, 4 months later, I suffered my stroke. It was in the early hours of the morning when my head started spinning. I felt nauseous, I started vomiting, and I could not stand up at all. The ambulance drove me to the emergency department of the hospital nearby. The importance of caregivers to stroke patients cannot be overstated, as they are totally dependent on them for everything, not just physical care like feeding, like bathing, toiletries, changing clothes, but also emotional support, listening, creative and stimulating activity, love, care, and the generous time provided. Over the years, I have seen my mother-in-law and the many stroke victims descend from healthy individuals to finally succumbing to it, and how utterly dependent they are on their caregivers. I was totally depressed, frustrated, angry, full of despair, and even embarrassment. During the early stages of my stroke, I suffered the embarrassment of having accidents in bowel movements and having someone to clean up the mess after me. I'm truly grateful to my wife and siblings for putting up with my negative emotions, but at the same time, being there for me. With this gloomy outlook, I felt like being in a dark tunnel with no end in sight. So I can truly understand how individuals can sometimes feel suicidal when they suffer a stroke. I was angry with God and even questioned Him. Why? Why did it happen to me? As we have been preparing couples for marriages and teaching natural family planning for more than 20 years, what more should I be doing? However, within a short period of time, 3 close friends died one after another. A 60-year-old, then a 54-year-old, and a 33-year-old. This message from God played in my head. Would you prefer to be buried or to be cremated? I should be thankful, and I'm indeed grateful to be alive. I had retired early, and without commuting and working, there should be less stress. Coupled with my regular exercise, healthy food intake, and supplements. I was also a non-smoker. So why did it happen? My neurologist replied with the following question. Are you 60 years and above? I say yes. Do you have family history? Yes. My dad passed away at the age of 42 after several heart attacks, and my grandmother had suffered a stroke before she died. Do you have high blood pressure? Yes, I do. Do you have high cholesterol levels? Yes, I have. Are you a diabetic? Yes, I'm on metformin. Are you obese? Yes, I weigh 84 kilograms when I suffered my attack. There you are, Matthew. You have just confirmed all the risk factors for stroke. And so I started my long, dark journey in the tunnel with no end in sight. I had to learn how to stand, how to transfer my weight so that I can walk with some assistance. After a few days of being hospitalized, the muscles started to weaken and I started doing simple exercises of strengthening my core muscles. I was introduced to different machines to build up the calf and the thigh muscles. Being bedridden, I was definitely not a happy camper. After being stabilized in the hospital for almost 13 days, I was finally discharged, given medicine, and told to come regularly for physiotherapy. The medication included higher doses antihypertensive, that is, to lower the blood pressure, anti-diabetic pills to bring down blood sugar, cholesterol-lowering statins and supplements. Additionally, I was put on antiplatelets, as these medicines are needed to prevent clotting and thereby secondary strokes to occur. The doctor also prescribed a traditional Chinese medicine, TCM, which has been reported to stimulate brain repair. After a stroke has happened, areas of the brain have been damaged. However, neural networks nearby can be restructured or repaired to perform the task of the damaged and dead tissues. 1 month after my stroke, I started to learn how to climb up and down the stairs using the walking frame and treadmills with weight so that I can build more muscles. I was encouraged by my fellow Billings ovulation method teacher to come help teach couples on natural family planning. I am quite sure that I was more of a nuisance and hindrance than help, as they had to wheel me around every now and then. However, I think this has greatly helped me to see light at the end of my dark tunnel and to unlock my passion once more for this ministry of serving others. With higher doses of medicine, I felt tired and sleepy throughout the day, but I was more active when the medication levels were lower in the evening. But by nighttime, I was wide awake as the medicine were very low. It was then I discussed with my doctor to split and space out my medicine from once daily in the morning to twice daily. Otherwise, I would have felt drunk throughout the day, and at night, I had to take a sleeping tablet to help me to sleep. By dividing the dosage, it had definitely improved my quality of life. And I was assured there will be sufficient quantities of medication in the night to prevent a second stroke to occur in the early hours of the morning. A few days later, I was taught to use a walking stick and learn how to walk while navigating obstacles such as wooden blocks along the way, basically teaching my brain on how to coordinate my movements again. More hurdles to overcome, walking sideways, and balancing to touch objects, movement that will help me to lead a normal life. After 8 weeks, I could finally walk without assistance from anyone or any devices like walking stick or wheelchair. I'm finally out of my tunnel. I was then recommended to go for acupuncture. Now, acupuncture has been used in China for thousands of years, but being Western trained, this was not included in our pharmacy curriculum. Fortunately, my neurologist did not discourage me to go for this treatment. The acupuncture practitioner was surprised that I came only after 2 months, as the golden period is 2 weeks after a stroke had happened. With any treatment, there is the possibility of side effects, and even pinpricks can cause internal bleeding, as the antiplatelet medication I was taking would delay the blood from clotting. My doctor then reduced the dosage of clopavix to just Plavix alone. After 1 month of 3 times weekly session, I was able to drive. I am now more independent in moving around. At 10 weeks, I improved by leaps and bounds. All treatments, whether medication, physiotherapy, acupuncture, exercises, and especially adequate sleep, contribute to my improvement, as after damage has occurred, the brain is quickly trying to repair itself to lead a normal life. The physiotherapist then started my sensory and brain stimulation exercises using different surfaces on bare feet. I felt very unstable on foam surfaces, artificial grass carpets, but more stable on hard floors. When I became like a drunken man swaying here and there as I walk on cobblestones, the damaged brain needed to relearn this sensory stimulation. Here in this video clip, you can see how unstable I am stepping on foam surfaces. All right. In the second video, I had to learn how to move text from a lower level to a higher level, and then the reverse while balancing myself. The brain has to learn again to do all these mundane things which we had taken for granted over the years. I noticed something interesting. While exercising on the treadmill in the house and watching a movie, my vision became clearer and the subtitles became sharper as I exercised along. However, after my exercise session and continuing to watch the movie while sitting down, the vision became blur again and double vision came back. Improvements can easily regress when we are lazy and no longer stimulating the brain. Now I try to learn new things, like typing the keyboard of a computer, like giving talks via Zoom, like doing online payments, and even playing computer games such like Heyday on the tablet. It lends to the maxim, use it or you will lose it. I'm also thankful for the many prayers, concern, love, and care from all the relatives and friends who have encouraged me to reach this stage after 10 weeks. Thanksgiving celebrations are not enough to repay for all their care and support throughout my recovery. Even 1 year after my stroke, we have to continually push boundaries to maintain our healthy lifestyle. Here you see me fishing at the kelong and passing on my experience to young children to enjoy the hobby, playing mahjong with relatives, enjoying durian feast at the durian plantation. My wife and I started traveling nearby, initially to Kuching, then Bali, and then further to Russia and the Baltic countries. In summary, we have to constantly push boundaries so that the brain can continue to improve and to live out our lives, like the Christmas gathering with immediate family members. In Vietnam, traveling around a small van on a boat cruise, enjoying fellowship with relatives and friends just before the pandemic locked us down in March 2020. Thank you for listening to my journey from utter despair, depression, and frustration to joy and happiness of being alive and back to my normal activities. Whenever I hear of someone who have suffered a stroke, I would encourage them and tell them there is life after a stroke. I would like to thank everyone, and especially our Father in heaven and my wife Serena, who have helped me to recover from this life-changing event. Thank you and God bless. Stay safe, everyone. Thank you, Dr. Pauline Lai, for your question. What would I advise caregivers who are looking after their loved ones suffering from a stroke? The first thing I would advise caregivers is to be understanding. They have to understand that their spouse or loved ones are in this dark, gloomy tunnel which they cannot see any light. Through understanding, the caregivers can then make the decision to love by being gentle, patient, and empathetic, forgiving when the stroke victim or strokee say hurtful things during these negative emotions. The caregivers can then be creative and encourage their loved ones to improve and recover by stimulating their brains to push boundaries, whether in simple things like walking, talking, performing simple tasks, and make them see light at the end of the tunnel. Strokees can then see reasons for living. However, it will be a difficult time for both patient and caregivers, and their faith in God is paramount in seeing through this period of recovery. Thank you, Dr. Pauline Lai.